Skin to skin contact after birth is really important if you've had one of these things happen in labor and birth, whether it's a pre-labor cesarean, an in-labor cesarean, an epidural, anything else that has been difficult for you. Because, if you have had difficulties in labor and birth, if it's been, we could say, traumatic or even anxiety inducing, that's going to tilt this parasympathetic sympathetic balance for you, and it's going to make labor more difficult, and you could end up feeling more of the anxiety out of it than the kind of calm and connection, that full oxytocin download that we're designed to get. So skin to skin contact is very good for that. It releases oxytocin for the mother in a constant way, not a pulsatile way. It's a little bit different, but it does release oxytocin for the baby as well. So the baby's soothed and settled, the mother's soothed and settled. And again, going back to, birth in the wild, there's nowhere else for the baby to be except on the mother's body. So people say, how long should you have skin-to-skin contact for? Well, there's no end to it, really. And even studies have shown that more skin-to-skin contact in the first month of life, mothers have lower postnatal depression scores, because we're getting all these feel-good hormones, oxytocin, prolactin, the breastfeeding hormone. And in fact, they studied those children up to 8 years old. That study came out recently, and those children had better emotional regulation from that skin-to-skin contact. Skin-to-skin, not just holding, but skin-to-skin particularly is powerful for this from those early days and hours after birth.